All right, Chris, hand it over to you to get us started.
All right. Well, good afternoon. Good afternoon, everyone. Welcome to the March broadband meeting. We've got a great agenda today, including a presentation on what's happening post ACP, which has been a topic of conversation for us at a couple of these meetings. So I'm looking forward to that and the discussion afterwards. But I'll hand it back over to Mark here in a second to do welcome and housekeeping and public comments before we move into the meat of the agenda with PSC updates. Mark, you want to lead us through the welcome and the open comment or public comments, rather?
Yep. All right. Thank you, Chris. Welcome to the Governor's Task Force on Broadband Access. Today is March 19th, 2025. I would just like to remind everyone that this is a public meeting and that it's being recorded. A meeting agenda is available on the Public Service Commission events calendar and also on the task force webpage. Also, in an effort to maintain audio quality, please mute yourself when not speaking. I also ask that any members of the public be mindful of their audio and remain muted throughout the duration of the meeting, other than during the public comment period. I will go ahead and do roll call now for those that are members of the Governor's Task Force on Broadband Access. Bob Abrams, B. Go Baker, Kwame Barnes, Marta Bechtel let me know she would not be here today. Brittany Byer also let me know she would not be in attendance today. Sal Carranza.
Here.
Thank you, Sal. Lori Collins.
Here.
Thank you, Lori. Angie Dickinson. Emily Dittmar let me know she would not be able to attend today. Russ Falkenberg. Chris Hershong. Gail Hike.
Here.
Thanks, Gail. Barbara Koldos. Chris Meyer.
Here.
Thanks, Chris. State Senator Mark Liner staff. Jose Martinez. State Representative Mersauer staff. State Senator Radcliffe staff.
Here.
Thank you. State Senator Paffer staff.
Half staff here.
Thank you. Mike Rave. Rachel Shemlin.
Good afternoon.
Good afternoon, Rachel. Thanks. Steve Schneider. Michelle Schuler.
Here.
Thanks, Michelle. Brett Schuttner. Josh Shell.
Here.
Thanks, Josh. Chet Strebe.
Here.
Thanks, Chet. State Representative Udell let me know he would not be able to attend today. And then Chad Young also let me know he would not be in attendance today. That is everyone. If I missed anybody, can you please let me know now? All right, I'll keep an eye on the attendance list. All right, Christy, okay if I just go into public comment?
Yep.
All right, now is the time where we will allow for public comment. This is a sole opportunity for members of the public to make a comment during this meeting. Members of the public may soon unmute and make a public comment should they desire. I do ask that public comment remain brief and also pertain to the subject of broadband access. You may also utilize the chat function in Zoom to let us know you would like to make a public comment as well. I will ask for public comment now. Second call for public comment. And last call for public comment. Hearing none, as a note, written public comment is also accepted on an ongoing basis. We have directions how to do so on our task force webpage, along with other information like meeting agendas, recordings, and updates. I will now hand it back over to Chris to lead us through the rest of the agenda. Chris?
Awesome. We're already 10 minutes ahead of schedule, Mark. Good job. Well, again, welcome everyone. The next item, the first item on our agenda for us today is PSC updates, which are going to be given by Alyssa and Rory. I'm not sure which one goes first, but please proceed.
My screen showing okay?
It is.
Great. All right, folks. So a lot happens very quickly here these days. So we wanted to just give everyone on the task force a rundown of what we've been up to over the last month here at the PSC. So I'll start by just giving some updates related to the BEAD program. I know you are all familiar, so I'll kind of flip through these first couple slides, but we've got $1 billion and 365 days to spread that money out across the state and find who best to serve. You'll remember this kind of map of locations in Wisconsin that still need improved internet service and are eligible for BEAD. So all of those orange locations kind of remembering that in your mind's eye, about 200,000 locations. We are working on allocating our money over that 1 year timeline. And last fall, we identified these 30 entities as eligible for BEAD. And just in this past month, at the end of February, we finished accepting our first round of applications of funding and requests for funding from these folks. So to read out on that first round of applications, which will be, I think, really the majority of the applications we'll receive through this process, we had 425 applications among those 30 entities that we approved, requesting just under $3 billion, which is a gargantuan amount. We have 1 billion, so it's good to see lots of participation. And I think one really big highlight for us, and I think evidence of success of the program so far, a lot of the planning we've done, the engagement we've had, and the guidance we've had from the task force. Of those, let me go back, of these 200,000 or so orange points on this map, we received an application in round 1 for 95% of them. So when we always talk about those hard to reach last little locations, even the remaining locations in Wisconsin that don't have good service, almost all of them, we already have somebody raising their hand to say, hey, we'd like to build here. Can you put in some BEAD money and let's get this done? So I think an overwhelming success in terms of participation in round 1. We're really quite glad to have a lot of good participants, a lot of applications for funding, and a really broad range of locations covered. So the results from round 1, I think, have been a resounding success, and kind of staff and members at the PSC have been day in, day out reviewing these applications. It is not an easy task to read $3 billion worth of applications. I'm sure you can imagine. So here's a little bit of a timeline update to go with that as well. We kind of approved our entities to participate. We opened our subgranting applications in January. We closed that application window at the end of February, and over the last 3 weeks or so, staff have kind of been reviewing those applications, reading documents, adding scores, things like that. We are making good progress. I can't begin to promise a day when we will be done with that effort, but our hope is in the next couple weeks here, we will wrap up our review, which will then mean we have preliminary awards for round 1. And then we will open a second round of applications, and that'll be for areas where we didn't make an award because we didn't have any applications that met the requirements. Or in some cases, if there's 2 applications that were very close together, we'll have a kind of a tiebreaker situation, and then we'll kind of allow those folks to revise. So round 2 will open hopefully in April. That one will be much quicker because we expect less applications because less locations will be left to serve. We'll try and wrap that up through April. Then starting in May, we get the really difficult task that we've always talked about of kind of filling in the gaps and negotiating individual locations and kind of straggler locations that are left behind on any of these awards we've gotten. And then I'll let Alyssa talk more about this in a minute, but we'll start working with kind of our alternative technology providers, our satellite and unlicensed fixed wireless folks to try and fill in some more gaps as well. All of this leads to, and we are sprinting towards the finish here in July, we will put out for public comment kind of that final plan for BEAD of how we're going to allocate our $1 billion in what we call the final proposal. It'll go out for public comment. The commission here at the PSC will review that and the comments as well. And then assuming the PSC approves or maybe makes some changes, but approves what we have, we will submit that to NTIA by the end of July. So another one of these little timelines as we've been and where we've been. We are right down in the middle there in that blue bar of the subgrantee selection process. And pretty soon we will be wrapping that up this July. With that, I will pass it to Alyssa for updates on Altech.
Thanks, Roy. Really a exciting year. So alternative tech, and this is not a definition that you see in the FCC, and it's not a definition for the state of Wisconsin, but it's specific to the BEAD program and the guidance provided by NTIA. And so in this case, alternative tech basically refers to the types of technology that can offer what we would call like the bead speed and latency. So the like 100 up and the 20 down and the 100 milliseconds latency or less. Maybe it's 1,000, 100, sorry. And the Milla got me. But maybe don't fit the requirements for a reliable technology. And so this is basically in the state of Wisconsin and largely across the country, unlicensed fixed wireless and low Earth orbit satellite providers. And they also have an important role in the BEAD program, and particularly for those incredibly hard to reach, scarce, maybe not on a road, don't have electricity, a number of locations in the state. And so there's two things that our office is sort of undertaking to get these alternative tech providers in the process. The first one was to make sure that if somebody is providing an alternative technology service already, an unlicensed fixed wireless provider is already providing one, that we don't award a different unlicensed fixed wireless provider to provide service on top of something they're already doing. So the first thing is kind of this certification and deduplication exercise. And as we've talked about a lot on this task force, sometimes the federal map often talks about the advertised speed, and sometimes that advertised speed can be based on capacity or for a certain number of customers, but that doesn't necessarily mean that if every single person subscribed to that service, every single person would be available to get the speed. And so we reached out to all the providers in the state of Wisconsin that were basically eligible per the FCC maps to certify through a letter on February 13th. And 3 providers basically responded back to the state of Wisconsin that they want to certify their service as meeting the BEAD requirements, and that to not have the state basically award any alternative tech where they're providing service. And so those 3, Acrospire, Lightwire, and Comelec, were the 3 that submitted that to us. They still are working on responding to kind of a data request to do the certification to the state. And so that's kind of step 1 of alternative tech. And the other part of alternative tech is to the same letter of intent process we did with other providers. So that the commission wants to make sure, and the state and the BEAD program all want to make sure that before money is awarded, it's clear that the applicant has the technical, financial, managerial, and operational capacity to take federal funds, administer the program, and provide the broadband service if awarded. And so the commission on Valentine's Day, I guess, we opened up our letter of intent. We closed it just last week. We had 8 applicants say that they wanted to be in the alternative technology part of the BEAD program. 5 of those applicants were already approved. They were already on the initial BEAD program. And so the review for them is completely de minimis. We've already reviewed their financials, their capacity. We sort of know we wouldn't have invited them to the round 1 if they didn't have that. We have 3 new applicants that we're currently reviewing their, as I said, technical, financial, and those are CompuAdopt, Earthlink, and SpaceX Starlink service. And so those are the 3 new basically providers that want to start participating in the BEAD program that are under review by the commission right now. And so Rory kind of talked about round 1, round 2. Round 3 is where you sort of go at solving for universal service with all the tools you have. The existing applications, the alternative tech, the sort of method of negotiation, basically asking people to increase the number of locations they serve or serve places without any bids or without any applications. So that's kind of where we are. I can maybe I'll just pause for 1 second and I'll say, I do want to acknowledge there's been a lot of talk, at least in broadband world media, about some potential changes, some incoming changes. There's been some bills proposed at the federal level. The state of Wisconsin continues to work towards our approved BEAD plan. We have, a grant agreement. It's not impossible that guidance will change or that we will have to pivot. But right now, we're basically operating on our volume 2 approved initial proposal that was approved, and we're basically taking the steps because it's incredibly important for the state to meet our July 28th deadline. That deadline has not been extended for the state. We still need to hit it as far as we know, and so it's important that we kind of keep taking steps, even while there's some discussion at the national level of possible changes. And so I don't want to not say that. If you read the broadband blogs or are hearing the news, and many people on the task force obviously are, we're well aware that there's those discussions going on, but we continue to sort of take the paces through our program as approved. I'll maybe go to the next slide.
1 second, Melissa. Thanks for that.
Oh.
I do see I neglected a question Bob Abrams put in chat that I want to address from my section. Bob asked, will there be a map of those 5% of locations not covered by an application? The answer is yes. Once we open our round 2 of applications, we'll kind of clarify which locations still are open and accepting applications and requests for funding. And that's where we'll see that 5%. We're still ironing out details and making that map, so it's not available yet, but we'll have it kind of around the time we open round 2. All right, I will move on. Melissa?
Great. And then I just wanted to highlight for task force members a second grant. We often talk about this Federal Internet for All program. BEAD is one side. The Digital Equity Act 3 programs are the other side. And so, as many folks know, we had a state digital equity plan. It was approved, and we then applied for formula money to basically implement that plan. And actually on Halloween last year, I don't know why we have so many things happening on Halloween, Valentine's Day, but on Halloween, we got our federal approval. And then staff went to the commission to have them sort of determine a little bit more of the exact eligibility and rules. And so just last Monday, March 10th, we opened our digital equity capacity grant. And I just want to really highlight how much this kind of, 1, aligns with our plan, but 2, aligns with a lot of the stuff the task force has talked about. So the commission will award grants. We have $9.5 million available for these competitive grants in 2 tracks. So in 2 categories. One is digital navigators. And this is something that the task force has talked about really, I think, from the very first report, certainly in concept, and then by the second report in specific name. And so this idea that there's a person, a paraprofessional, a helper needed for some subset of the population to really make full use of the internet. And so the idea is to increase internet adoption, improve digital skills and digital opportunities, really very specifically for people who need a little bit more help getting online. And so it's kind of some people might call it a white gloves. It could be a librarian, it could be an adult basic educator, it could be somebody who's specifically a digital navigator, but there's all sorts of people and helpers in our world that sort of serve this to really help people make full use of the internet. The other track is digital opportunity coalitions, and this track is really about kind of reflecting some of those task force ideas about how there needs to be sort of more local community capacity around these broadband planning, digital equity and opportunity planning, and that when you get local communities really deeply involved and engaged in this issue, you have a much better result. And so the other is to fund these types of coalitions or groups in communities. And the goal is that they would be identifying issues, raising awareness, improving communications, and really just strengthening the network of people and programs and services that increase that digital opportunity. So exciting that grant opportunity is open. The applications due May 20th, but it's really nice to see both progress for BEAD and the digital equity grants open. So I think that's the last slide, and oh, there we go. Sorry, I said it all, maybe. There you go. I think I already said that. So exciting time for the broadband office, and always lots happening between meetings. Chris, can I pass it back to you?
Absolutely. Sounds like a very exciting time, very busy time. So thank you for the updates, Rory and Alyssa. Next up on our agenda is a presentation from Drew Garner. Drew is the Director of Policy Engagement at the Benton Institute for Broadband and Society, and he'll be giving us that presentation on our post ACP environment. Drew.
Yeah, thank you, Chris, and thank you to the task force for inviting me to present. It's I think all the previous speakers have noted it's a very interesting time to be working in broadband, and everything always happens around the holidays. A lot of the comment periods that relevant to the ACP all lined up with Christmas and New Year's. It was a miserable time when we transitioned from emergency broadband benefit to the ACP because all the comments happened right during the holidays. But with that said, I'm going to share my screen and go through a few slides I put together. So I'm going to talk today about the ACP and affordability in general. But before I do that, I just want to talk about like what we're trying to afford here, like why affordability matters, why broadband matters, what we're buying when we buy a broadband plan. And so I'm sure you have heard these things a million times before, but broadband is heavily correlated with a lot of economic development and health opportunities. When broadband is available, it increases entrepreneurship and business revenue. Health outcomes get better. It's correlated with maternal health outcomes. Healthcare costs decline because the more you can take advantage of telehealth services, the less you have to rely on an ambulance to drive you from a rural area to a hospital, the less it costs insurance because insurance can be cheaper over telehealth. Veteran well-being, veterans that use telehealth have a much higher mental health score. You tend to see sort of reduced suicide rates among veterans when you expose them to certain telehealth treatments. Consumers save time and money on shopping. You can get obviously better things when you are able to navigate the internet. Student outcomes and lifetime earnings increase. Employers find better jobs. Employers find better employees, and employees find better jobs. 90% of job postings require digital skills. I just want to point out that's across the country and usually unique to each state as well. And then governments can cut costs. The more services like 311 you can take online, the less brick and mortar or call centers you have to use. I talked to a South Carolina Department of Parks and Recreation. They were given the goal for all their parks to become self-sufficient revenue-wise. And their key way to do that was to bring broadband to all the parks so that they can take advantage of some of the like hotel type tracking and room or rental tools, and then also to bring in certain attractions to the region. And as a result of that broadband and the tools they were able to use, their parks are now revenue positive. So there's a whole list of things. That's what we're trying to afford in these areas, all of this stuff, not just broadband, everything broadband enables. However, affordability across the country and in Wisconsin tends to be the largest barrier to broadband adoption. This is when compared to access or infrastructure and devices, and often just the skills to use it. Affordability is usually the primary reason people can't get online. And I just want to pull your attention to this incredible quote from Wisconsin's Digital Equity Plan. Across all geographies, demographics, and levels of access to broadband service, affordability is the largest barrier. That's in Wisconsin. It's also across the country. Every state has a similar sentence in their plans. Study after study after study after study after study find that affordability is the primary barrier. It's the barrier that keeps people from getting online, and it's the barrier, the perpetual barrier that causes people to intermittently get online and then drop off when they have an expense. Those intermittent connections or subscription vulnerability is a very important population to keep in mind. People who afford internet service 1 month, but then drop off the next when they have a medical expense or a car payment. I also want to note that telecommunication services, including broadband, is one of the top 3 causes of consumer debt in the country. So people, unpaid bills go into collections, people fall into debt, it hurts their credit score. This is sort of a preview for what happened with the end of the ACP. That did not help. One other factor I want to draw your attention to for Wisconsin, this is again is from your plans, but internet is more expensive in rural areas. It's more expensive to provide, and it's more expensive to the consumer. The median subscription cost in Wisconsin's rural areas is about $10 more in rural areas, but there's also a very large range. In some of the areas, the lowest possible price was $150 in some rural areas, which is not unheard of. That's surprisingly common. Some of the low Earth orbit, Starlink, namely, offer their standard plan is $120. But I will continue on. Now we get into the ACP itself. So the ACP was a tool, probably the best tool we have ever had to address affordability. $30 a month for typically low income households, even despite that barrier of having to qualify. Qualification could be really hard. A lot of people, it's really easy if you have a social security number and are already registered in the database. But it could take days, and you could have to upload documents for a lot of people. So this was not necessarily an easy thing to enroll in. And yet, over the ACP's less than 3-year lifespan, over 1 out of every 6 households in Wisconsin enrolled in this thing. There's similar numbers across the country. A ton of people. This is a very new program, wasn't around very long, and 1 out of 6 people took the time and effort to do the paperwork to benefit from this program. Personally, I think that's astonishing and a testament to people's desire for affordable internet. It's an essential service. People know it. They want to afford it. And the following bullet points aren't specific to Wisconsin, but they are specific. They are across the country, and they're pretty general. Most of the households who got into the ACP qualified because they're on other government benefits, specifically Medicaid, SNAP or food stamps, EBT, and then the Lifeline program. That means the qualifications for those programs, you are pretty low income if you're using those programs. For most states, for a family of 4, it's about $40,000 annually for a family of 4. Is like a representative household that's using those programs. So that's sort of what you're thinking of when you think of the ACP. And the reason most households on the ACP got in through these programs was because if you use these programs, you could automatically basically enroll in the ACP. You just need your social security number. There were databases at the FCC that would match with Medicaid or SNAP. And so you could very quickly enroll in the ACP. If you weren't in these programs or if your names didn't precisely match, then you get into the multiple days. I also just want to note that most of the enrollees who use the ACP used it for wireless or cell service. This was a trend that balanced out over time. Like the initial surge, like within the first month of the emergency broadband benefit, 9 million enrollees, almost all of them through the Lifeline program. So like the cell phone companies that were already participating in Lifeline really easily transitioned over to ACP, and they enrolled a lot of people right away. Over time, it shifted more towards wireline service. And then another interesting fact, Charter Spectrum in Wisconsin too, they were by far the main participant in the ACP. I think they got a total of about 24% of the ACP's money was for Charter. We don't have to get into why that is, but we can if people want later. And then the final thing, which I think is a little bit, to editorialize, a little bit tragic. There are a lot of studies, including some by Benton, some by the Brattle Group, economists, that show that the wider economic benefits, the things I talked about on that first slide, if you sum up those benefits, they would more than pay for the cost of the ACP program. So all the savings to Medicaid for using telehealth, all the better employment benefits, people making higher income, employers having better employees, the the savings to government programs, like those all add up to more than $14 billion, the cost of the ACP. And that point resonates with a lot of lawmakers. So people are aware of that, and they do understand that providing people internet, helping people afford internet, can be a way to improve government efficiency or reduce spending. Now for the end of the ACP, June 1st, 2024, last year. Again, 1 out of 6 households were hit with a bill spike, pretty much all at once. And again, telecommunications debt was already the #1 reason people were in debt. So a lot of these people, very low income people, were on the hook for a service that the government had effectively promised to help them afford. But then that benefit was taken away, and those households were then responsible for the bill that came due. It's not yet clear how many people are going to be put into debt as a result of this, but we do have some data about people who are no longer able to afford service. For the wireline, typically people who had a fixed or wireline connectivity, they were less likely to unsubscribe entirely. People who had the wireless service were much more likely to unsubscribe. And you can see this both in our surveys and in ISP earnings reports from shortly after the end of the ACP. And then just to preview one of Benton's upcoming survey results, Dr. John Horrigan with the Benton Institute, he has surveyed a lot of the ACP enrollees, found that of the 23 million households that were online, about 4 of them were newly online thanks to the ACP, and another 11 million were kept online thanks to the ACP. These were the households that intermittently come online and offline as bills come due. The ACP kept 11 million of them online. So a total of 15 million people were effectively brought and kept online thanks to the ACP. Based on these other numbers, a lot of them are probably struggling to afford connectivity. And I do just want to make the point, because this comes up a lot. Like, internet service is essential. So I don't think people will sacrifice to afford it. They will cut down on their food budget. They will do less healthcare. So just looking at the number of people who disconnect when you lose a benefit is not necessarily the most appropriate, because people sacrifice to afford it. So just a little asterisk as we go on. Okay, so I'm gonna stop. I realize I'm going long. I have a lot more, I've done a lot more, but I have a few more things. But I just want to pause to see if there are any questions about ACP or affordability in general.
Any questions for Drew? Go ahead.
Hey, this is Mark. Where do you see Wisconsin compared to the other states in the afterwards of ACP in terms of adoption rate or a drop in adoption?
So our surveys don't have state-specific information, unfortunately. And it depends on it's very hard to estimate that, just because we don't have access to a lot of the households. So you do have to really get specific. You have to look at ISP earning reports, and those usually aren't state-specific. But if I do find something, I'll share with you. I hate to give an unsatisfying answer, but
No problem. It's part of the deal. Thank you, though.
yeah.
Go ahead, Chris. I'll give it back to you. Thanks for letting me.
Sorry, I was muted. Any other questions for Drew?
Well, the last few thing I just want to flag is there's a lot of besides the ACP, there's a lot of stuff going on in the affordability realm. You all have probably heard about New York's Affordable Broadband Act, which, if you haven't, is a statewide requirement that medium to large ISPs offer a low-cost plan of $15 for 120 or $20 for 200 down. Yes, Bob, thank you. Referring to your comment in the chat. So New York led the way in a type of law that we're increasingly seeing other states consider. This is a statewide low-cost requirement. It got caught up in the Supreme Court. It was challenged for a long time and through a very convoluted process that has to do with reclassification, net neutrality. A lot of stuff shook out, but ultimately the Supreme Court said, New York, you are allowed to do this. The law can go into effect. So a couple months ago, the law came into effect, and so far, it has appeared largely successful. I put this little asterisk here because AT&T did leave the state as a result of this law. That's granted, they weren't super prominent in the state at the time. They mostly offered their, I think, AT&T Air service to a fairly small number of households, but they did leave the state. And so that's something to note. But most of the other ISPs has either applied for a waiver or complied. And then a lot of other states, notably California, Connecticut, Delaware, upcoming, Massachusetts, and Vermont, have introduced similar legislation. And I know a handful of other states that are considering it. So this model of a low-cost requirement is increasingly common. And then other states are pursuing a more subsidy-focused attempt, like sort of like a state version of the ACP. Oregon, Mississippi, and Pennsylvania have legislation that would do that. And I got a note too that Wisconsin, one of the I think 19 states that has a Lifeline Plus Up benefit. So Wisconsin's kind of a leader in offering a subsidy. I was looking at the Wisconsin program earlier today. It's, I think, a good model I would like to see other states consider. And just in case people love drama, the people are still fighting to continue the ACP. It's tied up in the Federal Universal Service Fund reform. If you like arcane legal procedures about the USF, there is a Supreme Court oral arguments next Wednesday, March 26th. The audio should be streamed, but this is the USF constitutionality is at risk. So if you are a high cost or rural internet provider, if you use the Lifeline program, if you're a school or library, or if you're a rural hospital, this could impact you. And then this is something I would like people's help with. But FCC Commissioner Brendan Carr recently opened up a new proceeding called Delete, 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 which is supposed to go into the USF programs and find regulations and rules that are no longer necessary or needed. So to the extent you work with Lifeline and have found friction in the program or think it could be improved, that is something I am personally interested in learning about. And then just the last thing I'll flag is BEAD itself has a lot of affordability requirements, most notably the low cost requirement. ISPs that win BEAD money are required to offer a low cost plan to certain low income households. I believe Wisconsin's is $40 with some flexibility through a waiver to go up to a formula amount around $65. Again, that's a way to address affordability. And when coupled with Wisconsin's Lifeline, could be pretty affordable. And then this is kind of a tragedy of BEAD without the ACP. But the ACP, that enrollment mechanism, National Verifier, its ability to qualify people, that is no longer there. So how ISPs implement and verify eligibility for low-cost programs is unclear. I'm sure actually the Wisconsin Broadband Office has thoughts on this and could teach me because I'm curious. And I will wrap up here because I realize I'm going long, but here's a quick slide on the difference between Lifeline, which is the current program that we have in USF, and the ACP. Lifeline enrollment is much lower than the ACP's as a percentage. That there's a lot of arcane reasons as to why. Maybe there will be some reforms to that. It's unclear. Also, Lifeline is much more limited in who can qualify. And then just the final thing I'll close with is the ACP is not the only way to make things affordable. there are a lot of other ways. There's a consumer subsidy like the ACP or Lifeline. There's a supplier side subsidy like the USF High Cost Fund, which sort of helps ISPs keep rural rates somewhat similar to urban rates. There's regulation like New York's $15 law. There are grant conditions like the BEAD low cost requirement, the voluntary BEAD low cost requirement, voluntary to participate in BEAD. There's competition, notably some coming from fixed wireless and LEO. You can reduce the cost to provide service through infrastructure grants or better middle mile open access networks. The business structure of an ISP determines to some extent what they're required to charge. Some of the private companies are more interested in making a quicker return, whereas municipal ISPs, in our research, can spread out the costs over a longer period of time, charge customers less. And then there are merger requirements. I think Frontier and Verizon are going through a merger right now. But in the past, Comcast and Time Warner, I think, I forget who the merger was. But when Comcast went through a merger, that spawned Internet Essentials, their low-cost plan. So those are opportunities to sort of create plans like that. And with that, I will wrap up. Those are all of my slides. So thank you again for allowing me to come and present here.
Well, and thank you, Drew, for presenting. That was very informative. Any questions before we move on in the agenda?
It was Charter and Time Warner for that merger. Let's put it in the chat.
Thank you. Yes. Yeah. And yeah, Spectrum Internet Assist came out of a merger, and Internet Essentials from Comcast did too.
Any other questions from the task force? All right. Well, now we get to talk to each other. So the next item is a group discussion that's going to be led by Jessica and Mark to finalize for open discussions on the presentation. Mark and Jessica, do you want to add anything before you send? I don't think we're doing breakout rooms. It's going to be a large group discussion.
Go ahead, Jessica.
We have a little bit of both.
Okay.
So we're going to start with the large group discussion. And rather than sharing my screen, I think I'll just ask you these questions, and I'll put them in the chat as well. So based on what you just heard, what information surprises you? What did you find compelling? What doesn't surprise you? Just looking for your reactions.
Jessica, I was interested in learning more about how the Wisconsin Lifeline benefit model fits within what Drew was describing. Not familiar with that. And the difference between the Wisconsin model and the national model.
I can answer if you want a little bit more details. Let's see.
Please do.
So Wisconsin Lifeline stacks on top of the federal lifeline. So federal lifeline, I think Drew's slide showed there's like, depending on kind of the voice only bundled with broadband, it's like 525, 925. And so Wisconsin then has our own USF that then the same people who are eligible and the same people who get Lifeline can stack it. And in the state of Wisconsin, it is largely used for voice and cellular service. And there is a minority of people and a minority of providers that offer broadband plans or like a bundled voice, like a landline plus broadband. The goal in the state statute is to sort of buy the service down to $15. And so somebody could get a reimbursement of up to $9.25, but frequently it doesn't quite work out that way. Most providers get something strange like $5.62 from the commission because we're trying to get the cost to the consumer to 15. Or there's a lot of cell phones that get the cost all the way to 0. And in those cases, the commission pays less. They have to be an eligible telecommunication carrier to participate in the program. So unlike ACP, where it's open to internet service providers who are not telecommunication carriers, eligible telecommunication carriers, Lifeline has a more limited participation group. And providers are not required to be eligible telecommunication carriers, and they're not required if they are eligible, they have to offer Lifeline. So I don't know if that's helpful. One of the things
you,
the state of
Alyssa.
Wisconsin does that's a super best practice though is it's very technical, but we signed this computer matching agreement with National Verifier. And so in some other states, they're just querying the federal databases. And in Wisconsin, we have an agreement that they can look both at the federal databases and they can look at our state databases. So we get a little bit more eligibility in our state because of that, because somebody might be like in a veterans, like in a certain program that Wisconsin qualifies them for the service. So we get a little bit more people eligible in our state because of that. If you've been around for a long time, it used to be called the CARES database, but National Verifier Query is that database. Sorry, that was a long and technical answer.
I think that's what was needed. Anyone else? What were your reactions? What surprised you? What didn't surprise you?
I don't think it surprised me, Jessica, but I was maybe surprised by the volume of work some of those early adopters did in getting people signed up. I guess I hadn't thought of that. It makes complete sense, but that's a huge number too.
Mm-hmm.
I'll connect it to the digital opportunity coalitions that were discussed earlier. It was those types of groups that helped to drive ACP enrollment too. Like having those digital navigators or coalitions were great for ACP and they can be great for Lifeline as well. This is a good investment in terms of getting people to take advantage of these benefits.
If there's no other initial reactions, we do have some group discussion planned for you. Mark, are you ready to go?
Yep, I'll just give the overview of what's going on,
Yep.
share slides, and then I'll get everybody into their breakout rooms.
Absolutely. Okay. So, in your rooms, we would love for you to consider your area of expertise, or industry, and think about what connections you made to the presentation you just heard and your area of expertise. What are you seeing in your field? Um, and then just more generally, talking about related to the topic, what's essential in Wisconsin? And then what possibilities exist and what are the barriers? And what we'll do with this information is for the next meeting, we will take anything that was discussed here, if it sounds like it's a focus area that we need to add to the focus areas we've already kind of discussed over the last couple of meetings, then we'll make sure that it gets added to that. But otherwise, we really just want you to connect on these questions. Your moderators will be able to share their screen. The questions will be up on the screen, so you don't need to remember them. And are there any questions about what I'm asking you to do? Just enjoy your conversations and look forward to seeing what you guys co-think about.
I'm going to throw everybody in their rooms now. Here they go. Do you want to share your screen with the?
Yes.
Let me know, any task force members, if you did not get into a room.
Mark, I'm not sure I'm in a room. Unless I'm in
Thanks,
room
Bob.
one.
You're in a room with us.
Wonderful. I just wasn't sure. I didn't get to the sign giving me the option to get in.
No, I was joking. You should be in a room.
Yep, you should
Looks
be.
like I'm good.
You should be now. Oh,
Mark, I didn't get in a room either.
Oh, there's Sarah. I was just looking for her. There she is.
Go. And I'll just kind of pop back and forth between the three discussion room slides so we can kind of see what they're discussing. You know, once they start typing out what they're discussing. Some of the barriers that one of the teams is mentioning is that rural areas are more expensive. Rural areas are concerned about adoption and affordability, and then lack of competition. Yeah, and so connections they're making to areas of expertise or industry, the affordability and access causing problems with school participation, especially during the pandemic.
I didn't talk about it, but there was another program similar to ACP called the Emergency Connectivity Fund that brought devices and connectivity to student homes during the pandemic. That has also ended.
Yeah.
Yep, we remember that one. Yep.
That one had like $400 for devices too, compared to the ACP's 100. So like you could get quality devices for the kids.
Yeah.
Feel free to bring that up when they come out of
Yeah.
rooms.
Yeah. Yeah, these are all reactions to the presentation you did, Drew. So feel free to comment on, you know, anything. And also thank you for that. It was really good
Oh, yeah.
information.
It's my job, literally, to talk about this stuff. So thank you. Presentations like this, I don't know if this is like a secret or something, but like because we're grant funded through nonprofits, like literally doing stuff like this is a grant deliverable. So it's like it is helpful to me.
It's like in education where there's the service aspect. Yeah. So then what's essential in Wisconsin? Wisconsin needs something to replace or augment ACP. What exists currently is not going to cut it. And popping down to other possibilities that exist or what the barriers are. Certain ISPs will get majority of funding because they can access those rural areas.
That's good. And Jessica and I left that question vague on essential for the task force to decide what is essential, where are they going to go with it, and how are they going to come up
I'm
with
excited to see what they're coming up with that.
Mark, that was a quick one.
Yeah, that was really fast. We need to everybody.
Oh, everybody's out of their rooms.
Yeah.
Well, we didn't have a
So
choice.
that wasn't intentional.
No, that was not
we can put you guys back in.
Why don't we
thought
do
we
that?
were-
Because we only got one of three
Yep,
questions
no,
looked at.
I'm gonna put you guys back in.
Wasn't
thought we-
intentional.
And we were worried we were underperforming.
No, you were not.
We like being chatty.
Yeah, no. There we go. And then all right. Should be all good now. There they go back. Yeah.
We
There's
just missed them so much.
Yeah. Yep. Yep. So I gave them 10 minutes because they're supposed to have 15 minutes in there. And then again, we're great on time. So
Yes,
we got plenty
we're
of time.
yeah,
So
yeah, we're
as,
we're good.
as Chris
I'm
noted
excited to
earlier,
see. Yeah.
got through things real quick in the beginning. So yeah, Drew, if anything, because you talked about time on your presentation, if there's anything else you wanted to add, feel free.
Mm-hmm.
Yeah, this is a cool way to run the call. Haven't been on one like this before.
Ah, awesome.
Well, again, thanks for coming. Happy to have you. And again, these discussions will inform our annual report to the governor and legislature on recommendations.
There's just kind of
Do
room
you want to
one.
do you want to share, Jessica,
Oh, it's not. Oh,
yeah,
it
the
says that I'm sharing. That's weird.
no,
Okay.
you were sharing before. Did you want to share the executive order?
Oh, yes.
Because
Yeah, that would be at
because you have a
before the
slide.
next discussion. Yeah, do you want me to share it now?
Yeah, yeah, you
Okay,
just
yeah, absolutely. So, the task force's charge basically comes through Executive Order 80. I like to put it on here so that if the task force members are, as they're in their discussions and they're just needing to reconnect with their purpose, the moderators can then pop back in here and take a look at this. But also, it's here for the public knowledge of what the task force is meant to do. So, meant to research and recommend forward-looking broadband policies and initiatives that address state broadband goals and needs, to promote the efficient strategic expansion of the broadband facilities and adoption across the state, to explore and develop solutions in collaboration with key broadband stakeholders and experts, to identify and prepare technical or white papers on top priority issues concerning broadband in Wisconsin as necessary, and to report to the governor and legislature annually by June 30th on all of those items there, which I will not read word for word, but really it's, it's a big job and there's very little time to do it. And so that's why we're here.
all right. Thanks, Jessica. Feel free to go back now.
I was logged out or I was stuck. My Zoom froze. So can you put me back into room 3?
Absolutely. Hi,
Sounds
Barbara.
good.
Thank you. Hi, Jessica. So sorry.
It's okay.
I'm going to throw you into room 2, actually.
Well, but my group's room 3.
All right, you convinced me.
Thank you. I gotta go back. Okay, thank you. Bye.
Bye. I like how everyone's being pretty innovative here. Room 3 has created a separate slide for them because they had overflow. So they just created a whole new slide.
One thing I didn't get into too much, because it involves like the federal changes that were sort of alluded to earlier, but the low cost requirement does certainly seem to be one of the things that is likely, in my opinion, to be removed. The impact of, I'm not going to speculate on what that would do to the scoring, but it is probably, it's just worth being aware of that might not be a tool for affordability.
And again, feel free to share that information when they come out.
Yeah. So let's see. Connections to their area of expertise trickle effect on contractors when the funding is no longer there to support services. Work with providers and communities. We are all in it together and everyone needs to figure out a piece of the pie. Communities are struggling with what's our role. Possibilities that exist or barriers. I think this is a possibility. Capture how we are reducing costs in other areas. You need to be able to explain the cost benefit. Yep. You pop up here. What's essential in Wisconsin? Educational and instructional content, telemedicine, access to medical appointments. I love how they're interpreting that question. That was the intent, was to allow them to interpret it how they would like. All right, let me go. Let's see what room 3 is doing. Bigger screen than a phone brought more benefits of ACP to subscribers.
That's
Getting
really
device. Yeah, go ahead, please.
So that's really interesting because there's a study from the Quello Institute in Michigan tying educational outcomes to basically screen size, or like if you have a computer versus mobile. And it finds that, like, yes, when you do have the bigger screen and the quality connectivity, student performance improves.
Yes, when I was working with you all, Mark, and the other, might have been before you joined. I guess I can't remember. On the state's digital equity, the data that kind of went into writing the state's digital equity plan. I recall speaking to a college who said that many students were writing papers on their phones, and that it was really very difficult. So training and support. If services get taken away, people will need support to adjust. Did they just create a third one? I think they did.
Great.
Okay, so room 2, let's take a look here. Okay. We got those, I believe. In room 1, entertainment was interesting. I mean, right? We are whole people.
Yeah, I love
We
to see
need,
that.
Yep.
yeah.
Yeah.
That's why Barbara wanted to go back into room 3.
Yes. We gotta make sure we have entertainment on there. No, we are whole people, and we need, it's more than just um, work and making money and going to the doctor and
Right.
accessing files and numbers and spreadsheets and stuff, right? It's much more. Business, remote work, improving communication, and business to business relationships. I want to let them know that they can create another. Maybe I'll just do it. Hopefully they find it. If not, they can.
Yep, they'll be able to find,
Yeah.
they'll see the real time. And then we're under the minute 30 before they come back.
Okay. Let's take a look at room 2 again. What possibilities exist? What are our barriers? Potential for smaller ISPs to get bought out by larger ones. Is that both a possibility and a barrier? We'll let them tell us when they do the report out.
Yep, great question.
Income gap between providers and communities. All right. I'm just gonna go back up here. And when they come back, I'll just leave it up here and then I'll ask for a volunteer. ETC certification. Do you guys, what is that?
Yeah, that's to participate for an ISP to participate in Lifeline, they have to receive eligible telecommunication carrier or something certification. But that is for most that is granted by the states themselves.
Mm.
So for Lifeline, you have to get ETC. ACP, you didn't. So that's why there were much more participants in ISP participants in ACP than for Lifeline.
Okay. Okay.
And ISPs complain about ETC all the time.
Yep,
Well, for good reason.
Yep, and that is correct. Some of those providers will not join in the
Right.
AT program, even though residents may want it because they want that option. But again, they would have to reach out and request that to the provider and
Yep.
to them.
Welcome back, everyone. Drew, I'd love to invite you as we go through each room, or did you have some overall comments you wanted to make based on what we were seeing while they were in their rooms, or do you want to just kind of, as they report out room by room, address some of the things you saw?
Overall, this is incredible.
Yeah.
Like, this is great. I'll chime in as people discuss.
Great. Is there someone from room 1 here? Maybe let's make this a little bigger. Is there someone from room 1 that would be willing to report out on what you had here?
I'm the one responsible for the very small text. I can read through and kind of hit some highlights for you, Jessica.
I tried to create another slide for you, but I didn't know if you would notice it or not.
Oh, I missed it. Now I feel
That's
bad.
okay.
Sorry.
No, don't feel bad.
So our group kind of talked about, we had some folks kind of in the education sphere and then also an internet service provider in our room. So kind of talking about, particularly we talked about some experiences in the pandemic and, internet access and being able to afford that internet access was a real difficulty in leveraging and getting educational content to folks of different backgrounds during the pandemic, and caused some pretty disparate outcomes as well. So that came up. Also talked about kind of the loss of the ACP benefit and how that kind of impacted the budgets and kind of day-to-day lives of some folks that were customers of one of our ISPs. And then talked a little bit about Lifeline as kind of an alternative, but ETC certification and some of the difficulties and regulatory barriers with that and kind of how that has limited most ISPs in Wisconsin are not ETC certified. And so that, well, I don't want to say most, but a good number are not. And so that causes some complexity. You couldn't just say, oh, well, I lost the Lifeline benefit. I'll just jump over. I lost the ACP benefit. I'll just jump over to Lifeline. It's not a straight one-to-one, an easy transition. And so that caused some trouble as well. We talked about in terms of essential, in Wisconsin, we talked about educational and instructional content, talked about tutoring services, telemedicine, access to medical appointments, both, for your physical health, but also mental health, counseling services. Also, just, it's a lot easier to communicate with your doctor than it used to be. You don't have to make a phone call. You can pull up your test results right away if you get a test result back or things like that. We had some debate whether or not entertainment is like an essential service, an essential component of broadband, but finding entertainment and joy in the day-to-day can make a big difference in people's lives. And
I mean, one of the dimensions of health, right, is recreation. So
I made the pitch that it is essential.
We are whole people. That's what we said when you guys were in your room.
And then when we talked about barriers, kind of that ETC certification was a point of discussion. And then just the myriad of other kind of state and federal laws that are kind of limiting the ability to deploy broadband. That's a lot. That's a mouthful from room 1, but that's what we had.
Yep.
Anything I missed?
Real quick, Rory, from Bob. He said, can the PSC consider providing clearinghouse for digital navigators not already connected to counties applying for it?
So
I might defer to Alyssa. Yeah. Alyssa?
So there's two things. One, UW Extension offers a digital navigator network of sort of people who are practitioners or thinking about it or counties. And so people could attend that. And then we're having a digital equity kickoff in April, which might be a neat opportunity for people who are like kind of trying to learn a little bit more. And if this is a fit for their organization and community to attend and meet people. And then I think those are probably the best ways. It's hard for us to list all the programs on our website because we'd never get it right. We'd never keep it up to date and all that, but there are some opportunities to join in some meetings. And then there's some national groups that do some really good work that have listservs and, affiliate finders and things that would be a good way for people to connect. And you can always email staff and staff will always offer as much technical assistance and help as we can.
Alyssa, I also mean volunteering to be a digital navigator in
I
addition to
think
that.
I think I think we could connect you, like Wisconsin Literacy just did a great presentation, just at a meeting some of us were earlier this week, and they almost all their digital navigators are volunteers, that do training and work, and they don't call themselves digital navigators. I think they call themselves adult educators, but it looked to me from their training like they were digital navigators. There's also 211 and the volunteeryourtime.org, which are great ways to sort of do that matching.
If
But
I
I
could
don't think
add
the
to
commission
that,
is going to let me host any more websites.
if I could add to that, Alyssa, I would say that well, 211 for one thing is represented at the Digital Navigator Network. So is the Literacy Council. If you want to, if you are curious about like who to get connected to, Alyssa just had some great ideas. But also, you could send a message to me or Chris Stark from Extension, and we could put you in touch with one of the members of the Digital Navigator Network. Because a lot of them have volunteer opportunities for this. So. Okay. Anything to add to room 1 information, Drew, Mark? Any questions from anyone else? Go ahead.
I just want I mentioned the delete proceeding, but that's where a lot of the ETC rules come from. And so to the extent people are interested in like exploring ways to make it easier or to change ETC requirements, like that is a opportunity to address that sort of thing. Because I hear that all the time. It was very hard. A lot of companies built up a big infrastructure to work on ACP, but were unable to make the transition to Lifeline, which is unfortunate. I'll put it in a +1 for entertainment too, because like, what's the point of everything if you're not going to be happy, enjoy life?
Exactly. How about a room 2 rep?
Yeah, I can report out to the group. So we've had lots to say. Thankfully, didn't need an extra slide. So what connections did you make to your area of expertise and industry? We had a contractor that talked about the trickle effect on contractors when that funding is no longer there with ACP to support services. And so it not only impacts, consumers of broadband, but also just everyone down the line and up the line as well. And then we had someone in education, and they talked about working with providers and communities and how everyone's in it together. And we all need to just figure out our piece of the pie and trying to figure out what is the community's role in ACP and having a replacement for that. Because I think we talk a lot about the provider side and maybe some legislation side, but how can communities themselves work together to help with it? A second question related to the topic, what is essential in Wisconsin? Well, Wisconsin just needs a replacement or some kind of augmented ACP for the state. What exists, as we talked about with the Lifeline, is just not going to cut it for what the need is in the state. And, with more cuts to critical services and changes and how people can access services like Social Security, it's just going to become more and more challenging if those folks cannot get online, which is what it seems like they'll have to be doing eventually to access those services. And then what possibilities exist and what are some barriers? Rural areas tend to be more expensive, and so rural areas are concerned about adoption and affordability. There's lack of competition, so even if you do get a connection to a place that previously did not have one, and in an unserved area, there still won't be enough competition to lower those prices. With that, there may be certain ISPs will get a majority of the funding because they have the resources to access those rural areas that are more expensive to build. And we could also capture that cost benefit analysis that was talked about. How are we capturing how costs are reduced in other ways other than just a lower internet plan. So just showing the benefits of having a program like ACP would be helpful. And then there's also an income gap between providers and communities, and where an ISP can't necessarily afford to provide an ACP like program without assistance from government or otherwise. And then lastly, there is a potential for smaller ISPs to get bought out by larger ISPs if those smaller ISPs can't afford to build. And I hope that I captured everything that we discussed. Am I missing anything? Room 2?
All right. Any reactions or follow-up questions for room 2?
You made me remember just 2 things. There's research showing that the ACP was also helped to drive infrastructure deployment, because for an ISP, if you know that this area that people are going to be able to subscribe and buy your services, that helps to attract infrastructure. So one of the tragedies of losing the ACP right as there's this infrastructure opportunity was that you no longer had this benefit to attract infrastructure to the low income communities. I forgot to sort of mention this in my presentation, but the BEAD low cost option that will sort of help to ensure service is affordable in rural areas that are almost by definition monopolies because they're just not cost effective to serve without a massive subsidy. That low cost requirement is probably one of the main things that is at risk in the federal conversation about changing BEAD. So that may no longer be a tool in the near future. Unclear. I don't want to speculate too much, but I would just keep your eye on that.
Thank you. Really appreciate the additional information.
It made me,
Room-
Jessica,
go ahead,
it made me think of another question I had for Drew earlier
Sure.
that I forgot about. But Drew, didn't Bend Institute do some studies and found out that the ACP program investment did more to help and be ahead of the game more than behind the game without the program in terms of investments and not losing money?
Yeah, we did a similar study. So I'll post them both in the chat, but both studies just showing that ACP connectivity generated economic returns for the user. So I'll put that in the chat. Thanks for reminding me, Mark.
Great. Thank you. Now, room 3. You just let me know when to change the slide for you.
Sure,
You're
sounds good.
prolific.
I can share on room 3. So I have each question on a separate slide. So for the first question, we had someone from the telecom consulting industry mention how they really connected to information on rural internet populations. We had someone from the banking industry, specifically the credit union realm, really connect to how the number of people who rely on internet access due to ACP and how changes in ACP can cause drawbacks in the banking and finance realm. We had someone from the K through 12 education and public libraries industry connect and think about opportunities for anchor institutions to be a part of county task force and coalitions working on specifically access and digital skills. And then somebody else mentioned that, it's really important, like navigators were really helpful in getting people signed up for ACP. So this is important to consider moving forward with anchor institutions. And then finally, for the first question, someone from the economic development industry highlighted that essentially all on the first slide applied, but they really had a hard time narrowing one thing down in the presentation because they really felt like the whole presentation related to solving economic disparities. So then going on to the second question and the second slide, we talked a lot about how there's an increase and increasing reliance on bigger screens. So bigger screens, like bigger than phones, brought more benefits of ACP to subscribers. And getting devices to people isn't always easy, but it's essential for people to sign up for ACP and use ACP. So getting people those devices could essentially be a barrier. And then we also talked about training and support. A fear of services being taken away was brought up. And so providing training and support for those people to adjust in the available services was important. And then going on to that third slide in the third question, we talked about potential cuts to Medicaid and Social Security, and the reduction in healthcare visits and how that will impact rural populations, especially in northern and west Wisconsin, and how this reduction could risk the continuation of ACP. And so ideally, we would increase telehealth online visits covered specifically.
Excellent. Any reactions or questions for group 3?
One thing that I forgot to mention, there was another program during the pandemic that recently ended, the Emergency Connectivity Fund, that worked through schools and libraries to provide students with home connectivity and high quality devices, $400 devices. So that's another thing that has recently ended, that is impacting students and library patrons.
Mm-hmm.
And I put like the device screen size thing just for awareness. I put in the chat a study from the Quello Institute in Michigan on this exact topic about how student outcomes are correlated with screen size and connectivity.
Great. Thank you so much. Okay. So by the way, this issue is part of our next discussion already, because you guys already came up with this as something that we should consider addressing in 2025. So I'm just going to move over to, I'm going to get us going right into the next part of our discussion. So as I mentioned last time, I'm going to include a slide with Executive Order 80, the charge of the task force, so that your moderators can, if you want to kind of take another peek as a team while you're in discussion at what your charge is, you are welcome to do that. We went over this while you were in your breakout rooms. We went over this sort of more point by point as information to those who might be watching the meeting as well. So in 2024, and there were 3 recommendation categories. All of the recommendations fell under one of these 3. There was preparing for BEAD, which was a little more complex. So I put all of the different things that are included in preparing for BEAD. So that was utility, telecommunication and broadband facility locating, permitting, workforce and training, grant administration, and tribal coordination. The second category was continued investment in state broadband programs. And then the third was affordability and adoption. And surprise, surprise, the recommendations you guys have come up with so far all fall within those 3, again, +1. So I'll tell you about that here. So I want us to talk a little bit about the 2025 priorities. This weird looking slide here is organized in a couple of different ways. First, you have the colors. So those are the categories that I just showed you that were in the 2024 report. And these have been color coded. These are your 2025 ideas that have been color coded by those categories. So again, we have affordability and adoption in the first 4. So this is also organized by number. So 1 through 4 is affordability and adoption. Continued investment is numbers 5 and 6, 10 and 11. Probably should have numbered that differently. Preparing for BEAD is numbers 7, 8, 9. and then 12 through 16. And then the fourth one tended to be more operational and internal in nature, internal to the task force itself. And that was more about things like ensuring representation on the task force, ensuring representation and also enhancing representation on the task force, particularly when in discussion of affordability and adoption. And then there was sort of an internal operations note, but about shifting the focus towards public needs. So we've been focused a lot on a lot of other things. So it's organized by number so that you can refer to these by number as you take your notes, and it's also organized by color, just for your information. What you're going to do in your breakout rooms is your moderator, so it's number 1, 2, and 3. This is breakout room 1, breakout room 2, breakout room 3. You basically each get 3 dots. If you've all been involved in this before, it's dot voting, the nominal group voting but in a little bit of a different twist, because your group is going to come to consensus on where you're going to spend your dots. I want to be really clear that this is about where we're going to focus our conversation at our next meeting. We're not going to lose if something doesn't get a dot, but you guys think it's really important. We're not going to lose that. This is where are we going to start our conversation? And then we can move on to another tier. So you're just choosing what to focus on first. So your moderator is going to move this dot to move each of your 3 dots to wherever your team decides are the first 3 areas that you would like to focus on for discussion. These funny looking dots down here, that's kind of a bonus dot. So room 1, room 2, room 3, you each get a bonus dot. If you want to use it, you don't have to use it. And then each team has a discussion page. So from that discussion, it's really very much up to your team what's important for you to capture. There's general notes, there's lingering questions that you've got, and some ideas that I would say these ideas, if you could keep them to ideas about your top 3, that would be great. But it's really open and up to your group what kinds of ideas you want to capture. I just need you to be clear about what kind of idea it is, whether it's related to one of your top 3 or not. Is that clear? It's a lot of instruction. Or I should say, is it unclear? Is something unclear?
I just have a question, this is Sal. We have different colors here. The top 4 at the beginning are the main general focus. And then we have different underneath them. So what we're going to choose is the top or anything around here. What is most important?
So we're choosing the priorities for our discussion, what we'll start to develop some recommendations around at our next meeting. So these are the priorities for discussion. And so, yeah, and then the numbers don't mean anything about, there's no rank or anything. That's really just so that in your notes you can say, hey, number 1 should be rewritten, or numbers 7 and 8 are too similar. Let's put them together. That's if you wanted to do that, but you're not required to. Does that help?
Yeah, I thought that there was a ranking.
Oh yeah, no.
The colors. That was my confusion. But there's
yeah. And the colors are just so that you can differentiate room 1 tends to be this kind of orangey color. So I tried to match it a little.
Okay, got it. Yeah, but the top priorities are not ranked either.
Right. These are not ranked. It's just a number for you to refer to them. Yeah.
Perfect. But that was my confusion.
I was trying to avoid you having to retype everything.
No, that's great. Thank you.
Yeah, of course. Okay. Any other questions about what I'm asking you to do? So you rank, and then you've got a note page for you to have some discussion and idea sharing. Sorry, I called it a rank. I meant spend your dots. Spend your dots, and that's allowing us to focus those priorities for discussion. Okay.
Yep, and now there's going to be two rooms, room 2 and room 3. I closed
Oh.
down room 1.
Got it. Okay. Can they spend room 1 dots?
So, yep, feel free.
All right. Use all the dots on the table here.
Yep. There we go. And then they should have the right amount of time, and here they go.
Thanks, Drew.
Yeah, thank you, Jessica. I have to jump for another call, but I really appreciate you bringing me on. And I love how you organize this call. This is very productive. Thank you, Jessica.
Excellent. Thank
Thanks,
you.
Drew.
Appreciate
I'll see
it,
you
Drew.
around. Thanks, Mark.
I know that was a lot of instruction.
I think it makes sense.
Yep. And
Excellent.
I was gonna explain to Drew before I left. Don't forget to tell people about how we're doing it here in Wisconsin.
Yeah, I know. I know.
Yeah.
I kind of wanted to say something like that too.
So I'll do it in my email to him. So like I said, Rory, you weren't on here earlier, but he was really impressed with how our meeting format is
Great.
and our discussions and yeah, just how it's run. So
How we do it in Wisconsin, best practices.
Yeah.
It's a real kudos to you, Jessica, and you, Mark. You guys, it's great.
It's a great partnership.
I couldn't agree more. But
Thank
Mark, I'm not in a room.
Oh, they kicked Rory out. Oh, geez.
I had to rejoin the meeting, so
Okay.
that might be why.
There you go.
Thank you, dear.
Thanks, Lori.
See you later.
All right, Mark, I'm hovering in the background. Call me if you need me.
I see one of them disappeared for a second when someone tried placing a dot over it. Hopefully. Oh, I wonder if there's the order. Hold on.
Oh, there they go.
I was gonna say, let me just. There we go. Everything should be set. One of my favorite things is designing stuff like this. But it's way more fun to have someone to work with. So, Mark, I appreciate that.
Yep, no problem. And again, just trying to change up that format. Not always have one talk and write, have them, have it written out for them on what they already spoke about and give them the option how they feel again for their past discussions. So
Exactly.
it's a good format.
Should I delete the room 1 discussion notes?
Yeah.
Okay. There we go. 2 and 3 then.
And they have 11 more minutes, but they might not need the entire time for this one.
Yep.
Maybe. But
The note.
we're looking good on time right now.
Yeah. I feel like the notes area was a little bit more of an optional
Yep.
piece on this. So I wanted them to be able to spend time coming to consensus on the priorities or
Yep, absolutely.
the discussion priorities. Yeah. Group 3 is voting away. I like using those fancy programs like Slido that plug into and lots of other programs that do this too, that plug into this, but I kind of like these like low-key ways of doing it too. Just a circle that you move around.
Yeah, because again, you don't even have to go into the Slido program. You can just create it here.
Right. Hmm. I did worry that numbering them would look like I was ranking them, but I'm glad someone asked that question.
No.
So far, just because I'm sure it must be small on my screen or on your screen, I'll just quick say that one of the groups is looking at, again, these are discussion priorities where we're going to start our discussion. And that's advocate for funding beyond BEAD to ensure comprehensive coverage, addressing potential gaps in underserved areas, serve as a resource for efficient BEAD implementation and effective communication with the legislature, and provide support to ISPs in the BEAD implementation process. And then one of the other groups has placed a dot on the first one, address concerns about the end of the Affordable Connectivity Program and explore replacement solutions, and ensure the continuation of existing programs that support families in affording broadband. And it looks like group 3 used their bonus dot there as well. And group 2 also has placed their dot on the advocate for funding beyond BEAD.
Let's see if they use up all the dots.
Yeah, I feel like they're going to not touch the group 1 dots, even though we told them they could. Just gonna peek at the discussion. Okay, there are no notes there. 1, 5, 10, 13.
That's the dots they selected.
Yep.
UW extension. That's it.
Yep. I mean,
That's all
drop the
you need,
mic.
right? That's all you
Drop
need,
the
right?
mic. That's all.
Yeah,
That's
yeah.
all you need.
To Bob's comment on digital navigators and volunteers, and like I said, I know I mentioned it during the navigators meeting. There are navigators out there again that are doing work on their own and then looking for support. So I do refer them to, again, Digital Navigators Network and any other of the entities that do that type of work.
Did you see the link I put in the chat?
Yes.
Okay, good. You can use that. It's just a Google group thing, but
Yep.
it's
Yep. Is
yeah.
the only issue with that one is that some people may not have permissions right away, so they'll need to get their permission.
Oh, you mean like at their workplace, they may not be able to access Google Groups?
No, like when they access it, like they'll need permission on whoever runs that Google Work doc. So you from permission from you or Chris, probably.
Oh yeah, when they sign up,
Yep,
I get a
yep,
notification and
yep.
yeah. Yep.
Because that's what I had to do. I did automatic.
Yeah. You know, and I don't use Google Groups. I don't run a Google group that often. And so like I had to remember how to do all of that too and actually learn how to do some of it. Um, let's see. Oh wait. 3. Okay. Group 2 still has some, they still have a dot left. They don't have to use them all.
Yeah. Listen,
But
it's
looks
under
like
5
there's,
minutes now. It might go the whole time.
yeah.
That's good.
There's some more notes down here. Ideas. Provides 12 and 15 with workshops and technical assistance. Let's look at 12 and 15. So 12, continue efforts to remove barriers to construction and expedite the building process with a focus on improving permitting procedures. Yeah, I've talked to some agencies too about how we can do that. And provide support to ISPs in the BEAD implementation process.
That's that one we extended that we knew where we predicted might be a big one for them.
Yep.
That's what we combined.
Oh, 12 and 15, not 12 and 13. Oh, I'm sorry. Let me look at 15. Understanding permit process for local and tribal governments. Okay, this makes more sense. And BEAD specific permitting and opportunities for adjustment.
And then number 15 is another one we combined.
It is, yeah. So 12 and 15, they're saying extension is a strength in these two, and we might already be providing them. Okay. Seems like 17 and 19 can be combined, and then also combine 9 and 12. Let's look at
That it,
17 and 19. Yeah.
and we did that intentionally.
Yep, we did.
Yep, we did that intentionally just to see, and along with the others, see if anybody, but that's the one, two where we're like, well, those could be combined. So it's good they caught on to that.
Uh-huh. 9 and 12. Yep. Yep, we saw this too. So that's good. I always prefer it when a group is able to like decide that that's what they want. It's really helpful.
Kudos to them to see it. It wasn't just us.
Should we send them a warning or can
No,
they see?
they get the warning.
Okay. Okay.
But they got 2 minutes and 15 seconds left, so should be coming up soon. Are they still typing away in there?
Let's see. It looks like they're probably discussing and thinking.
Okay. Looks like they're about to move a dot. Oh.
There we go. It wasn't me. Hey. Oh, hey, they moved it. Continue efforts to remove barriers to construction and expedite the building process with a focus on improving permitting procedures. Oh, looks like they're ready to move their bonus dot.
Let's see how fast they type. They got 8 seconds left.
Advocate Gov's goals this upcoming year. Feels like this was enough time. I hope it was for them.
Nope, we're still doing good on time.
Welcome back again. How did that go? We were debating. Do you feel like you needed more time, or was that a yeah? We always need more time with these breakout rooms.
I think we got a lot done in breakout
Yeah.
room 3.
Yeah,
Good.
it looks like you all did. Before I ask you guys to report really quick, and this will be a little bit of a shorter report out, I'm just wondering, were there some, was it really hard to pare it down to 3? Yeah. Just a quick reminder that this was about where are we going to start our discussion next month. We'll pick another tier as we get together and we finish up those discussions. We wanted to focus the discussion on the things that you guys felt were most pressing right now, and then we can go to another tier of ideas that you've come up with so far. So let's talk about your discussions in your rooms. Who from room 2 is willing to share out? Or Sal, did you have something you wanted to say?
No, the only one I want to say is we discussed the operational, but we just decided that maybe numbers 17 and 19 should be combined.
Yeah.
We don't necessarily chose those because it was operational, but we thought it was important. We never had time to put the last dot around, but but we decided that was operational. That is about us as a
Yes.
broadband and how we operate, right?
Yes.
Jessica could move that dot for you.
I just want to
Yeah.
make that point because we did discuss that.
I'll just put this on number 17. Well, we said that we could also use up number 1's dots. So I'll just put that on number 17.
Okay.
And if you guys, we still have 3 more dots to use up. So like if you want me to move something as you guys do your report out, you just let me know. I'll move it for you.
And one point that you said, Sal, about 17 and 19, there's a few of them that could have been combined that Jessica and I discussed, but decided to leave them separate to see if what you guys can come up with. So thank you for recognizing that some of those could be combined, because that was done intentionally to leave them uncombined.
And that was one of the reasons we put the 2 in between 5 and 10.
You felt that those could be combined, is that right?
Right. We
Okay.
thought that pretty much it could be combined, mostly because my point was, if we need to advocate for funding, right? Who are we going to advocate before most strongly with our legislature? So combining 5 and 10 serves the purpose of saying we're going to advocate, but one of the groups we're going to be advocating, before to support is the legislature. So I suggest that we just put it in the middle.
Right. And when you think about this, and this is something I see all the time with strategic planning, a lot of times something is mentioned as a goal, but really it's a strategy. And I would see serving as a resource being a strategy toward advocating for funding beyond BEAD, right? That's a strategy for that. So yeah, that makes sense.
Well, I think also making other, in addition to just 5 and 10, what we saw in number 1 was also part of the implementation of that strategy. What I saw.
Okay. Yeah. Yeah, it does make sense.
We're already we're gonna be ready to go next month. Okay, so room 2, any other summaries, or did you want to call anything else out? You had number one, addressing concerns about the end of the ACP, exploring replacement solutions. You had between the 5 and 10, like Sal was talking about, the advocating for funding beyond BEAD and serving as a resource for efficient BEAD implementation and effective communication. And then number 2, focus on improving workforce development and job outcomes across the state. And then continuing efforts to remove barriers to construction and expedite the building process with a focus on improving permitting procedures. Anything you want to add to that?
Say that could kind of go with number 9, developing efficient processes, but we do want to recognize that we weren't always talking about our state processes. It's how do our state legislators influence the federal programs that are out there through our elected officials, because sometimes our state office is doing the best they can, but we hurry up and wait, and then it changes. So it may not be necessarily directly our office that's having the issue, but how we can maneuver the federal programs.
Awesome. Thank you. Group 3, I'll just quickly say that, you had some matches with group 2. So that was the number 1, addressing concerns about the end of the ACP. Numbers 5 and 10, advocate for funding beyond BEAD and serving as a resource for efficient BEAD implementation and effective communication with the legislature. And then where you had different ones, you chose provide support to ISPs in the BEAD implementation process. Did I miss one? No, I think that's it. Did you have anything you wanted to share from your conversation?
Well, like you said, just ultimately we picked 1, 5, 10, and 13. And then I noted an idea not related to the priorities we picked, but that UW Ascension could provide 12 and 15 through their workshops and technical assistance. An example was providing assistance on the permitting process, including for tribes, and how to implement and deploy technology. And I also noted that it was mentioned in our discussion that there are things advisors can't help with, but part of the ultimate goal is to advocate for the governor's goals this upcoming year.
Great. Thank you. Anything else from group 3 that you'd like to call out? Or group 2 or 3, any reactions from about what you've seen here today? Okay, really quickly, before I turn it over to Chris, I'll just mention again that we're going to take these pieces, the suggestions that you had for all of these, and put them together. And then next month, during the task force meeting, this is where we're going to start our conversation. We know that there are other issues up here to discuss that you might feel are just as important. But we're going to start this as sort of like the tier 1 discussion. And then we'll move on from there once we've gotten through that first round of discussion. Does that make sense to everyone? Okay, cool. Chris.
All right. Thank you, Jessica. And thank you, everybody, for participating today. It's always helpful when we have great discussions. I find value in those discussions as well. So thank you. Couple of announcements. Our next meeting is going to be on April 23rd in Madison. This will be at the Hills Farm State Office Building. The PSC office will be working on getting information about that meeting out to us. That meeting will be from 1 to 4 that day. So it'll be a little bit longer meeting. We're making a trip down to Madison, so we want to make sure that we have some meat to the agenda so that we can spend valuable time. And we'll be working on those final recommendations for the plan. Mark will be sending out more information on that. And then our next meeting after that will be on May 21st, and then we'll be back to virtual at our normal time. So April 23rd on site in Madison with more information to come. And with that, unless there's anything else for the group today, we can adjourn and enjoy
Just
your.
one more thing, Chris.
Oh, go ahead,
look-
Mark.
That in-person meeting, looking at noon to do some task force
Yep.
networking between the task force members before the official meeting begins. So I'll send that information out as well in
Yeah.
the email.
Thank you for calling that out. It's on my list here and I just glazed over it, but that's actually what I'm really looking forward to, is meeting you people in person and getting to share information. So I look forward to seeing you all in April and having our meeting in person.
Thank you.
Thank you for your time today, everyone.
Thank you, everyone. Good to see everybody.
Good to see everyone.
See you
Thank
in
you.
April.